Dr. Kevin Kavanagh is a retired physician and also founder of an organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
Let's start with this first thing. Dr. Kavanaugh is really good at keeping me up to speed on all the stuff that's going on in terms of COVID. And the first thing you sent me says natural immunity longer lasting than the Pfizer vaccine for prevention of Delta variant infections, 13-fold increased risk. Can you tell us about that?
Well, yes, and that's all over the internet. And it's a little disturbing because people are using this as, I guess, a reason to not get vaccinated, which it's not. Because remember, safer doesn't mean safe, greater doesn't mean great. Still, both groups are at risk for COVID-19. And this study also showed that if you had a past infection, plus then get vaccinated, you've got increased protection against the Delta. The CDC did a study which showed the same results. So if you've had an infection of a previous variant, it is very wise to go on ahead and get vaccinated. This is what is recommended because it will give you added protection against the immunescape variant of Delta. So that is very important. And certainly, if you've got the choice between vaccination versus getting a Delta infection, you want to choose vaccination because the Delta variant appears to be much more virulent than the previous strains, causing twice the hospitalizations. And believe me, it is something you don't want to get because it's not just whether or not you die, but it's also whether or not you're in the hospital, you're on the vent, and you've got chronic disability. Many people that are getting infected have lasting effects from this infection. And a vaccination can prevent the severest types of outcomes from the Delta. Everything I read states that vaccinations provide good protection against being admitted to the ICU, being on the ventilator, and dying. And they also provide good protection against being admitted to the hospital. Might you be admitted? Yes, but if you are, it's less likely and you'll be less sick. So please get vaccinated.
So should a person get the vaccine if they had COVID-19 to a pre-Delta variant?
Definitely. 2 studies have shown that that will up your immunity. These strains are starting to evade the immunity that's provided by the previous strain. That's what evolution does. This virus is out to win. And so you can't think in terms of herd immunity or I've got this immunity or immune to that type of coronavirus, etc., and I'll be covered for all. It doesn't work that way. Each strain that comes in is getting to be more and more like a brand new virus. And so herd immunity is not applicable. We need to make sure we keep our immunity up to the highest level possible. And the only way to do that right now with the Delta variant is adding on vaccination. And I should add, that's one of the reasons why there's such discussion and rush to getting boosters, because with the Pfizer vaccine, it appears that there is significant waning immunity as you get further and further out from vaccination. For example, 5 to 6 months out, and you're over the age of 60. That's a particularly high risk group. So you really do want to pay attention to that. Ask your provider when you're eligible. Of course, if you have an immunodeficiency, have had an organ transplant, you're eligible for a booster right now. The Moderna vaccine looks like it's providing a higher level of immunity that has over 3 times the mRNA in its formulation, and it appears to give a stronger immune response. So if you've had the Moderna vaccine, you have somewhat more protection than the Pfizer. But all of this is why everybody still needs to wear masks and follow public health advice. Very important. And when people say cloth masks don't help or they're no good, well, they're good a little bit. I mean, they'll provide you better protection than not having a mask, but by far, in my opinion, you want to get a medical grade or a KN95 or an N95 mask.
I read this and man, it scared the wadding out of me. The new South Africa variant, I think it's called C.1.2. What can you tell us about that?
Well, that's scary, and that's one of a number of variants out there that have people very worried. I think that's one of the reasons why you're hearing all the pundits and the scientists saying, well, look, we may get another large wave over the Christmas holidays, and it may be from a variant that escapes the vaccines. But remember, many countries have been able to control the Delta variant and have been able to control just the coronavirus outbreaks in general using public health strategies, not with vaccines. The United States is one of the few countries that have a lot of vaccines. If you look at Singapore, you look at Australia, you look at New Zealand, and even China, they're controlling these outbreaks very successfully with public health strategies. In other words, avoiding being up close to people, avoiding gathering in large groups, and also wearing masks. All of this really is effective in reducing community transmission, which reduces your likelihood of exposure, and if exposed, your likelihood of getting the virus. Now, I should also add that they're just watching these variants, because it's one thing to be a virus that can evade a vaccine. It's another thing to have the infectivity that will allow it to spread and cause a pandemic. So, we still don't know for sure, but there's a lot of worrisome signs out there. And believe me, there's a lot of data that indicates that you're not going to get herd immunity. I mean, you may get it to the Delta variant, but not to the C.1.2 variant that's coming out of South Africa, new virus. And there'll be another variant after.
Back to Dr. K and a whole bunch of auto tech service techs. Are you ready, sir?
Ready.
Hi, Dr. K. Is there a health risk if you fall asleep wearing an N95 mask, say on a long distance flight? That's from James. That's a good question.
Well, it is, and I don't think that there is one, because I've fallen asleep actually in that situation and have survived. But certainly you want to try to keep awake, obviously, on a flight and be alert around your surroundings. Of interest is that when you're actually on the airplane and sitting in the seat with the air coming down on top of you to the floor, this is a pretty safe cone of protection. Airlines have up to 10 to 15 air exchanges per hour, about one every 3 to 6 minutes. And so it's just incredible the amount of air exchanges that they have. And being on the plane is a lot safer than going through the security line and being in the terminals. So you have to wear protection. I would wear goggles if I was going on a plane. And I think fly only when you absolutely need to. I think flying right now at the height of a pandemic, if it's just to go on a vacation, is not a good idea.
Here's one that says natural immunity is never discussed. Survival rate is over 96%. If you get it, majority of admissions, I guess, are vaccinated. Thought it was to prevent getting the virus. Majority of hotel, I guess is what our hospital admissions is not from people who are vaccinated, correct?
Absolutely. The majority of hospital admissions are from people who are not vaccinated. And when he says never discussed, apparently didn't listen to the first half of the program. Yeah. That's just...
Yeah, we just did.
Yeah, that's just talking points that the anti-vaxxers have. And a lot of this, I think, is organized and even pushed from some of our foreign adversaries, because we're in a real weakened state right now. But no, vaccinations keep you from getting in the ICU, keep you from dying, and greatly protect you against being hospitalized. England just had a study out showing that they reduced transmissions by 50% in the household. So no, they're not 100%, but boy, they do offer you some protection. And I can tell you that a lot of hospitals, they're running out of ICU space, they're running out of vents, they're running out of oxygen. And when you have someone who's not vaccinated, his prognosis is extremely poor compared to those individuals who are vaccinated or, for example, have a non-COVID disease that needs desperately treated. So they may be on the wrong end of the triage decisions because they are sicker, They do require more resources, and don't inflict this upon families. Jack, right now I have 6 friends that have had either their children, and this is adult children, or their brothers or sisters that have been severely sick with COVID, either in the hospital, and some have died. And I mean, I have never seen this with any type of infectious disease. So this is a serious disease. Vaccinations work, and we need to get vaccinated to get through this Delta surge.
Just to support what you're saying about the hospitals, I saw a story this morning. I had to look at it twice. Idaho hospitals are down to 4 ICU beds in the whole state. That's unheard of.
Well, yeah, and see, when you get that low, they're already starting to triage. They're leaving some beds open for kids and for people that would come in that they have to see desperately, but they're already starting to lower their standard of care because the resources are so scarce. And so this is, to me, very problematic. This situation we're in now is affecting non-Delta patients getting necessary treatment. And everything from biopsies to diagnose cancer to even cancer treatments. We are in a very bad situation right now.
All right. Let's go to Laura. Good morning, Laura.
Good morning. Good morning, Jack. Good morning, Doctor. Listen, I have a question about how doctors are educated. I know different kinds of doctors, their training specializes in different things. Can you explain Rand Paul and how his different credentials and training would explain, if possible, the fact that his advice is so different than other doctors?
All right.
Thanks.
Okay, you can listen off the air. Go ahead, Doc.
Well, Dr. Paul has excellent training. He graduated from Duke Medical School, Duke University. He became board certified, and of course he started his own board more as a protest than anything else. So there's a lot of misinformation, and as you all know, I've disagreed with some of his stances, but other stances, regarding the CDC needs to step up, cloth masks aren't that protective, I'm in line with. But the remediation for that isn't to do nothing, it's to up N95 production, get people good masks, and let's up our public health strategies in order to confront the virus. So it is difficult, but that is more in a political arena. It's not a scientific one. There's a lot of vying right now over who's going to be the top dog, who's going to run this, who's going to run that. And we really need to get away from that and get more into what works. Certainly, people need to recognize the narrative that this pandemic is a hoax. That wasn't correct. The narrative that we heard all last year being beat to death during the nadir between every surge was, we've reached herd immunity, you're alarmist. That wasn't correct. I've heard that now 3 times. We didn't reach herd immunity. And when we get over this Delta variant, we will not have reached herd immunity because, as Jack said, we've got even more problematic variants sitting in the wings that can come in and reinfect us. So we need a change in our type of life. We need a change in strategies, but we also need to get together as a society, look out for one another, and come up with a national strategy to combat this pandemic. That is of utmost importance.
Thank you so much. We will talk to you not this coming Friday, but a week from Friday. Thank you so much, Dr. K.
Thank you, Jack.